Good morning, everyone. I'm showing 10 a.m., so we will begin. As a reminder, this call is being recorded, and this is an open forum format, and so you are able to mute or unmute yourself as you wish. You may hover over your name and click to unmute, or if you are on phone line only, you may press *6 to unmute yourself. So welcome to the, I can't believe it's already August, Georgia Discharge Data System Strategic Planning Monthly User Group. From GHA, I'd like to introduce Bill Wiley. Bill, our Senior Vice President of Business Operations. I'm Leslie Sainovich, our Senior Director of Data Services, Sharifa Navos, our Data Integrity Specialist, and Stephanie Taylor, our Data and Analytics Specialist. And feel free to turn your camera on so we can see your face. Robert, good to see you on there, but don't be shy. We should all be Zoom or some kind of video pros by now. So it's good to have everyone on the call. It looks like we have close to 30 people on the call, and we'll get started. Today we're going to talk about and recap the final 2019 GDDS data set, which has now been closed. Just to touch on our limited data set for 2020 for anyone who's still interested in that subscription. Sharifa has developed some strategic planning module instructions that are going to be published in the visualization tool. Just a review to touch on what we've talked about the last few calls is some COVID-19 data monitoring, specific payer codes that are related to COVID-19, and some data analysis that we've done internally. And as always, this is your time to ask questions, to ask for any demonstrations, to give your feedback. So we welcome your participation. As always, I like to go over what the Georgia Discharge Data System is and just give you a visual of the data flow at a very high level. You guys submit the data to our vendor, Heidi, which is a subsidiary of the Missouri Hospital Association, in the UBO4 data format. That data is then processed and analyzed. It is scrubbed, so to speak. It is quality checked and becomes the Georgia Discharge Data System. There are specific codes, DRG codes, service lines that are assigned to that Georgia Discharge Data System. That data set is then provided to GHA and goes on to our visualization tool. It is also submitted on your behalf, which is required by law, to the Brain and Spinal Trust Fund Commission, the state of Georgia. Those are the two mandates that we submit on your behalf. And then we also utilize the Agency for Healthcare Research and Quality and the Healthcare Cost Utilization Project to, they perform any of the research data requests that we receive from universities and researchers. And all those data requests are vetted thoroughly, first by HRQ, and then secondly by our legal department and our data services department here at GHA before we allow any of those de-identified data sets to be released. So the 2019 data has been closed. The data is now in its final format in what we call the Q5 data release. That data will be uploaded to the visualization tool in the coming weeks. So that 2019 data will be in its final format. I will be releasing the 2019 final data to the various entities that were shown above, and as well as the limited data set users will receive the final 2019 data set. And with that, I'm going to ask Sharifa to give us kind of a recap, a preview recap of what she will be releasing into the notes to the study that will be posted on the GHA Data Services member resources or resources page. This data or notes to the study kind of gives some insight onto what she has been working through during the year, during the data submission, and the final observations or special notes regarding using the 2019 data. So things that would be helpful for you to know when you're running any kind of data analysis on the 2019 data. Sharifa?
Yes, thank you, Leslie. Good morning, everybody. And this is, as Leslie stated, an example of what you will see. These usually are the first couple pages of the notes to the study. And I've posted the previous ones because I do one every quarter on the website under the Data Services Resources section of the website. And this kind of shows you throughout the year, what hospitals or facilities were having issues either submitting data or had volume inconsistencies or discrepancies or errors that they were working on fixing. So if ever you were running any reports or analyses and you saw that, a particular facility was missing data or had any issues, then you could go there first to kind of see if it's been notated. And then of course, like many of you have done, you would email me and ask me, what's going on with, you know, whatever hospital that you're looking at when you're doing your comparisons or any type of comparative analysis. So this is an example of that, and it'll be updated. Some of these will drop off because a lot of you have corrected and resubmitted your data, and I'd like to thank you for that too. The 2019 database looks really good, so I appreciate everyone being diligent and partnering with us and Heidi to make sure that you were able to fix your errors and resubmit on time. You can go to the next slide. And again, this particular report or notes to the study has information about hospitals that have been acquired or mergers or closures, so you can always see that for the year. So here is an example of Northside, our formerly Gwinnett Medical Center, who was purchased by Northside or acquired by Northside, and we'll put that there just so that you know if any name changes or any, if you don't see a hospital anymore and you don't see any data after a certain date, then you can go there to see if that facility closed or if any changes were made to any other departments. You can go to the next slide.
Let's pause.
Anyone has any questions? Okay.
Yeah, let's pause here and see if anybody has any questions. Remember, you can hover over your name or your image and click unmute, or you may press *6 to unmute yourself if you're only on a phone line. Any questions? Well, I'd like to say personally, thank you, Sharifa, for your hard work and your diligence in reviewing the verification reports and working with hospitals to make sure that our data is as clean and accurate and complete as it can be. So great job on the 2019. Moving
thank
forward.
you. And can I add just, please, if any of you have anything that happened in 2019 that you'd like to make me aware of so I can include it in my final report, please feel free to email me. Just if you change your EMR, like your electronic medical record vendor, transition to Epic or Meditech or something, or anything that major that happened, a closure of any type of, a wing or a department in your facility, please let me know. And I'd like to add that too, just so that other facilities are aware of any changes, because that sometimes, and I would say 90% of the times it does affect the data. So thank you. And this is showing this new point of origin code that was released on Monday, so August 3rd, 2020. And it's code G, which means transfer from a designated alternate care site. And this is coming from the programming staff at Heidi, and they've implemented these changes to incorporate this code into the data collection process. And it will be applied to the next strategic planning module update. Although the August data, because we're doing the monthly plus 2 weeks, so 45-day turnaround for the submission, it won't be available until mid-October. And this is due to, I guess, changes relative to COVID-19. And so make sure your billing staffs are aware of these changes. If you want to pass that along to your billing staff, we posted that form on the website. Here, yeah, Leslie's going to show you. So you would go to Data, Georgia Discharge Data System, and then click on the Data Services Resources. And I just posted that this morning. So you can just click on it, download it, pass it along to your billing staff so that they're aware that there is a new point of origin code. And again, that will be implemented I guess it's been implemented as of Monday by our HIDE programming staff.
And this is also where Sharifa publishes the notes to the study, links to the presentation and webinar. So there's all kinds of helpful information here, the authorization forms to gain access to the visualization or the readmission tool. So remember that this resource is here, this resource site is here for you within the GHA website. It does require a log on, but it's easy to, most of you you're all in the system. So there's an auto retrieve of your password if you need it. So just let us know if you need assistance with that.
And any questions about this new point of origin code? And again, you can review it yourself, but.
Okay.
Yeah.
So this is the 2020 schedule that we are, on track. And again, we can't thank you enough for continuing to submit your data on time on a monthly basis, especially during the pandemic. It's greatly appreciated, and we're, we're here to support you in any way we can. So thank you. Also wanted to mention that we're anytime during the year, if you find that you are interested in subscribing to the limited data set, just contact me, and what I need from you is the authorized person's name and title to email the DocuSign to, and then I need 2 additional authorized users and email addresses who are identified to have access to download the data. The limited data set is a de-identified patient level statewide data set that's released 5 times throughout the year. It's totally voluntary, and it is additional fee for the subscription, and it's inpatient and outpatient, and I'd be glad to discuss that with you if you have questions. So just wanted to remind people of that. We will be releasing the Q2 data set. That will be probably at the beginning of September, end of August, beginning of September, that will be available. Bill, if you would chime in on this new fund here.
Sure, absolutely. Thank you, Leslie. Obviously, you all know about the various coronavirus relief acts, and specifically the COVID-19 uninsured, I think it's called the Uninsured Testing and Treatment Fund, that's supposed to cover uninsured patients for the cost of testing and treatment of COVID-19. Back in, I guess it was May, which would have been March and April data. We heard some hospitals starting to kind of question how they were supposed to do that, and honestly, there was no consistency on what the questions were. We heard a lot of folks call it the federal fund, the COVID fund. United Healthcare actually administers it, so we heard it even called the United Health COVID fund. Hospitals are supposed to bill the code as they would any other payer, and that is the payer code number is 95964, and there are a number of different requirements in there where the primary diagnosis code is present, and we'll map that to others. We have identified several eligible codes where COVID-19 is the primary diagnosis, and for claims before April 1, any claim marked with U07.1 and after that are B97.29, those claims are automatically mapped. There's a number of testing related codes as well, and claims can actually go back to February 4th to be eligible for reimbursement. So we're seeing this as folks are resubmitting earlier months. To make things easier on the hospitals, we just decided to use an existing payer code to hopefully means no hospital has to make a change to their extraction format. So any claim that now is marked with that payer code 95964 and has a COVID code related to it will be mapped over to an existing payer code that was a HRSA Migrant Health Program, code 342. It has very little, actually had no inpatient volume. And so we're going to rename it the Migrant Health Program COVID-19 for the time being. So this should apply and be automatic for the hospitals. And if folks go back and resubmit February, March, and April data, and they can retrospectively bill, it should be mapped toward that. I think the next slide, Leslie, has the actual numbers that were associated with the diagnosis codes and things like that. So that's what we think, that hopefully putting all that in on the back end will mean that the hospitals have to make no changes, and it will allow us to identify all of the COVID claims and compare hospital census against what's already been submitted for COVID patients back from March 2020 and ongoing. So now we also have the flag for the diagnosis code for both inpatient and outpatient. We talked about it last month about where the flag is going to be added to the record table. So we think all that should be squared away for any sort of COVID data going forward. But I just wanted to reiterate that for everyone, if there are folks that have been asking about what to do with that uninsured COVID fund and how to place that payer. So that should be automatic now for the hospitals, but it is available to go back and resubmit if you need to. I think the next slide.
Well, and we did determine that for the limited data set, the flag will be included in a separate table.
That's right.
Instead of tacked onto the patient record table. That's
right. So let me tell you a little bit, and I'm glad Stephanie's on the call today because she's the one that's actually been doing all of this data. With the data that we've been getting from public health and the stuff that the hospitals are submitting on a daily basis around bed availability and things like that, we have been doing daily snapshots so we can quickly identify any sort of hotspot areas and things that where we may see trends with hospitalizations and things like that. And you can see on here, what we see, and it has been, obviously it spiked a little bit. I bet if we went back to where that green line moved away, that's right around Memorial Day. So it was a little bit about what we were expecting. And the good news is it seems to be leveling off a little bit. Down at the bottom, we get the bed and vent availability. So, you can see that there's obviously an issue about the submission from ER data on one particular day. I don't think we ever had an ER that went down to zero. Next slide. So what we look at on a daily basis is any sort of availability issues around general acute care beds, critical care beds, ER and vent availability, but also the total number of COVID and PUI. So this is as of last Wednesday. What we're trying to figure out, and I know we showed this a little bit last week, or last time, is if we're allowed to send this out. Public health has been telling us they're going to put all this on a dashboard that hospitals will have access to. They did a demonstration of a data program. Gosh, Leslie, when was that? April timeframe? I mean, it's been a while, and they wanted hospitals to sign up for it. We have asked repeatedly if we could send this level of information out to the hospitals, just so that they would have a good idea of where things flow as well. We've done some things where we aggregated them up, taken out some of the individual hospital names. So we've asked again. We have put it to public health to see if we can share this level of information and do it on probably a weekly basis. Daily, it bounces around a little bit. Mondays and Tuesdays in comparison, Mondays and Tuesdays always look good because some data is not consistently submitted over the weekends. The good news is the total patient or total COVID and PUI has been steady somewhere in the last couple of days, or almost week and a half, 2 weeks, somewhere between 3,800 and 4,200 total COVID and PUI. So we saw a spike there for a little while, but it seems to have leveled off. So we hope that we'll continue to see that leveling. I'm in a county where school districts just went back in person. So I might pay a little bit closer attention to these daily dashboards and what Cherokee County looks like over the next couple of weeks, just to see where that is. But as soon as, if we can get permission to send this out, we will. But, you know, reach out if you've ever got questions, and maybe we can give it to you on an individual basis or something along those lines, or give you some relevant numbers to compare your hospital. Next slide. So I wanted to show this. This is information you all can do too, but you know, we've heard the anecdotes, and it's a little shocking when you actually see it on paper. We reported this back in April. Well, this is April data, so we reported it to leadership last month. We knew volumes were down. I mean, we had heard that from hospitals across the board, but I don't think you really pick up on it until you see it in comparison. So you can look, you know, January, February, March, obviously a decline, but then when you hit April, it just falls off the board. Total inpatient down 54%. So from a little bit over 1 million encounters to less than 500,000 in a month. And you can see that graph below is the total COVID and PUI going up. So some of that had been even offset by those totals. So that didn't, I mean, that gives you a great comparison to what actually happened month over month. So it's a little eye-opening when you see it. The next slide we'll show a couple of down to the actual. I'm gonna have to try to zoom in on this so I can actually see them. You can compare certain service lines to see what it was like from one month to the other. The one I remember right offhand, oncology. January, you're usually seeing about 1,500 inpatient claims per month. Let me see if I can zoom in for myself. I'm gonna have to. So it went from 1,500 down to 1,000. You can look over even at some of the other service lines. General surgery, 6,000 cases, you know, down to less than 4. The other one, let's see, where is cardiology? Interventional cardiology, 2,400 cases on a normal month, you know, down to 1,300. So these are, one, generally speaking, significant drivers of revenue for the hospital. So we know that there was a lot of lost revenue, but these are also services where early detection or early intervention is critical. So, you know, these are, again, eye-opening services that we're seeing a complete drop down in inpatients and really missing out. So, you know, hopefully, and we are seeing, we're getting the May data, and we'll run this exact same comparisons and stuff for May, but hopefully it'll start bouncing back and looking a little bit like March. But you can see that inpatient, that's a cliff. I don't know any other way to describe it. That is falling off a cliff. And the outpatient on the next slide is just as bad. And again, we broke these down by services to see just how much of an opportunity cost. The next thing we're going to try to do with this, and we may be calling on some of you, we're going to try to see if we can quantify a financial impact. So what the actual finances are, you know, we're going to have to get a little bit analytical with it and do some cost to charge ratios and figure out some payer mix ratios and things like that. But to figure out, again, what not only the cost of COVID, but the opportunity cost of lost patient revenue and lost patient encounters. and then try to compare that to what the CARES Act was able to provide, and then see if we can't figure out a way to advocate for additional reimbursement or additional grants and things like that. So this is all obviously information that you can pull from the limited data set, or you can pull from the strategic planning tool. But we wanted to pull this out and show you specifically what we've been doing internally with it. And again, we knew it. We knew what to expect, and still, when you see it on paper, it is very shocking and very eye-opening. So before I turn it back over, I'll take any questions or comments, or honestly, any other types of analysis that you think would be helpful to kind of tell the hospital story about what you saw in March, April, May, and things like that.
The chat is available too if you would prefer to send a comment through chat or a question.
Okay, well, if there are no other questions, I'll turn it back over to Leslie.
Thank you. During this time, we have had, which has been a good thing, we've had some increased engagement from users to use the visualization tool. So we appreciate that. And so we thought it might be helpful to come up with, and Sharifa spearheaded this, to come up with a helpful tips little documentation that actually is going to be included on the visualization tool as a separate tab in the README. It also has already been published or posted to the data services resource page that I showed you earlier. So Sharifa, I'm going to turn it over to you and let you just kind of go through this at a high level of what this looks like.
Yes, thank you, Leslie. And that's, again, something that I posted online, and also will be part of the README section on the strategic module tool. And so this is helpful tips, meaning that when there isn't really like a user manual or anything. So when you're using this Tableau-based module, it kind of, it can be overwhelming. And so we want to give you some tips to make sure things transition smoothly, especially when you're selecting multiple filters. And so there's a pause button at the bottom left of the screen that we recommend that you pause everything before making your filter selections. So it, decreases the lag time between selections, because there's so much data in that, it takes a while for everything to reload and refresh. And so once you do that, you're able to make all of your selections, and then you would, and if you go to the next slide, you would resume, and then that'll refresh the data and all the quadrants. There's multiple different tabs have different quadrants, and we'll go over that, but all of them will be updated, and you can, download your data, and it just helps save time. So here here's an example of one of the headers that you'll see. And in order to download the data, we've noticed that you have to click within the data, and usually we recommend that you click within one of these blue headers. And once you click that, then the crosstab and data tabs under the download button on the bottom right will appear. If you don't click on that, it'll be grayed out. So a lot of people have been calling me. I've been getting a lot of feedback from people who are ready to download the data, and then they're like, why isn't this, showing up? And that's because you have to click within the data, and then that shows up, and then you can download it in CSV format and save it as an Excel workbook, create pivot tables, or put it into your system, or whatever you need to do. And so here are the tabs that we have for the strategic module tool. And many of you are aware of these tabs. The two newer ones are the DRG analysis and data export tabs. And so the market trend analysis and the market analysis with county are the ones that are pretty similar. And we can go over that on the next slide. And those ones basically show you, and everything is kind of generated or updated as you select your filter. So it allows you to create detailed analysis from a hospital service area, you know, whether they're seeking treatment at another facility or whatever you're trying to see, you know, how many, if you're doing like an out-migration report, these are good tabs to use for that type of report. And so it shows you patient outflow volumes, service lines, and expected revenue impact. And the one with the county map has a map. So it's kind of like a heat map, you know, showing you volumes in particular counties. And that's a very insightful report that people like to use for out-migration reports as well. Then we have the revenue code analysis tab, and that one displays the total number of revenue codes. The numbers you'll see there will be inflated just due to the fact that it doesn't count the encounters, but it's counting the number of claims. So if you look at this particular tab, don't be alarmed because the occurrence count on the revenue code analysis tab, is not counting the number of claims. So you can have one single claim can have multiple revenue codes, and those can be billed multiple times. And so the counts will be inflated. But a lot of people, again, like this particular tab to look at, to do analyses of their revenue codes. And then we have the DRG analysis tab, and that explores the DRG and MDC code levels that are present in the encounter. And so you can use that to get a broader scope of payer types, patient types, primary payer, et cetera. And that's one of the newest tabs that we've added that I feel like people who usually do a lot of DRG analysis can use to their benefit. And the data export tab also showcases detailed analysis of market share factors for both inpatient and outpatient service lines. You can download it by quarter, so the discharge year and quarter, and you can filter areas such as DRG, primary procedure code, diagnostic code. So you have the 5-column spreadsheet that you can use. And again, you would click on the header to be able to download that as well. And that's it. I mean, again, I will be posting this on the actual website. There'll be a README section at the end of the week. The programmer is going to be putting that on there for us. Also, I put a PDF version of this on the website where we show you earlier under the data tab. You go to Georgia discharge data and the data services resources. It should be there under the Javion new visual strategic planning module, and there's like a training material, so I put it under there, under training materials. Yes. So these are the helpful tips. If you have any feedback or anything that you see while using the tool that you'd like for me to either create some type of manual or a little training worksheet, please let me know. Or if you have any more questions, please let me know as well.
Piggyback on that. Thank you very much, Sharifa. This is just kind of to get you started, but please know that we are here to provide any additional training for you or your team. We'll be happy to jump on a half-hour, 45-minute Zoom to provide some training on how to use this tool. So just please know that Sharifa and I are available to do that. And we would welcome the opportunity. I did have a question in the chat to review again what we talked about in the point of origin. So let me scroll back. So the point of origin code G has been added. And so I guess your coding department needs to be aware that that is a new code that they need to incorporate. Now, I'm sure that your EMR system will have that. You're available, but probably it'd be a good idea to pass that documentation on to your coding department and also your EMR. And that documentation is also available here under the data resources. So feel free to download that and pass that along. Any other questions comments, feedback? We certainly don't want to take any more of your time, but we're here. We have the hour set aside. If there's anything further you would like to discuss, or questions or feedback. Again, this call is being recorded and it will be posted, should be by the beginning of next week at least, with the PDF version of the slides as well. Sharifa will take care of posting that. And our next meeting is September the 2nd, again at 10 a.m. If there are additional users you would like to be added to this meeting, feel free to forward their names to us and we'll get them added to the list. And again, we're here for you anytime you need assistance with data or have any questions. Please don't hesitate to give us a call. Here's our contact information. I'll leave that up on the screen. But if there are no other comments or questions, we'll give you some time back in your day and hope everyone stays safe and healthy, and we'll talk to you soon. That will conclude today's call.